Hello, I'm Dr. Ken Landa. Thanks for watching. Let's talk about Prozac or Fluoxetine. It's an antidepressant. It ranks in the top 25 medicines prescribed here in the United States. And as a matter of fact, if we look at those top 25 medicines, we find 3 of them are antidepressants. Came on the market in 1987 and subsequently in 2000, given another name called Serafem, specifically for premenstrual dysphoric disorder. The patent expired in 2001. Now there are plenty of generics available. It's on the World Health Organization list of essential medicines. Prozac is the first SSRI, selective serotonin reuptake inhibitor, that was approved by the government. Prior to that time, there was only the tricyclic antidepressant family or the MAO inhibitor family, both of which had a lot more side effects and had more severe potential in overdose. The indication for Prozac is either the acute or maintenance treatment of major depressive disorder, obsessive compulsive disorder, or bulimia, or could be used for the acute treatment of people with panic disorder. Now, if we look at the dose is the same for depression and obsessive compulsive disorder. Typically begins at a dose of 20 milligrams in the morning, and if necessary, after several weeks, then the dose could be increased to 40 milligrams or 60 milligrams, or rarely to 80 milligrams. That's the maximum. But most people are adequately controlled on 20 milligrams. For panic disorder, the dose is about 10 milligrams. If person suffers from bulimia, the dose tends to be 60 milligrams. The dose should be lower in people who have liver impairment, or the elderly, or people who have other medical diseases, or people who are taking multiple medicines. Now, once you start taking the drug, it's not going to become fully effective to at least 4 weeks after you begin therapy. And if you're taking it periodically after a while, you need to reassess whether you need to continue taking the drug. Taking the drug does not necessarily mean that it's a lifelong medicine. As a matter of fact, it's not really been studied for long periods of time. Typically, the studies that were done in major depressive disorder only lasted 5 or 6 weeks. Response was considered at least a 50% improvement in what's known as the Hamilton Depression Score. Well, about 50% of the people improved by about that much. It seems like fewer people who continue to take the drug are going to have a relapse of their depression. It's a first-line therapy for people who have some sort of depression, but exactly how much depression you have to have in order for the drug to really work is a question. So some people believe that the evidence for it working in mild depression, which most people have, is really not all that good. Some people think that you have to have at least moderately severe or severe depression in order for the pill to really work. And a study that was done that evaluated the effectiveness of 21 antidepressant drugs found that Fluoxetine, or Prozac, was among the least effective of the drugs. And as a matter of fact, some of the studies showed that its effect was really insignificant in people with mild to moderate depression, but it was significant for people who had severe depression. Interestingly, if an airplane pilot suffers from depression, he or she may take either Prozac or Zoloft or Celexa or Lexapro, and that's it. Those are the only drugs allowed in this category. Now, if a person has obsessive compulsive disorder, another indication for the drug, well, it's based on the Yale-Brown Obsessive Compulsive Scale looking at people who have moderate OCD, say a scale of 22 to 26. Well, the drug decreases their symptom score by only 4 to 6 points. So in other words, about 2/3 of the people get either minimal or no benefits, and only 8% of the people who suffer from OCD get significant benefits. If we look at bulimia, well, people who have a baseline of 5 to 10 bulimic episodes a week, if they take Prozac, that number is going to be reduced by about 2 to 4 episodes a week. But if they take placebo, going to be reduced by about 1 to 2 per week. So in other words, the benefit you get by taking the fluoxetine or the Prozac, if you suffer from bulimia, 5 to 10 episodes a week, you're going to improve by about 1 to 2 episodes. So again, it's not a home run or anywhere near a home run. And if we look at treatment of panic disorder in the 12-week studies, looking at a significant number of patients, the number or the percent free from panic attacks taking the drug averaged about 50% in those people taking fluoxetine or the Prozac. But in the people taking placebo, the people who were free of the panic attacks, somewhere between 25 and 50%. So again, it helps, but it's not a home run. Off-label, the drug has been used for treatment of premature ejaculation or trichotillomania, pulling the hair, or cataplexy, or obesity, or alcohol dependence, or binge eating, or somewhere on the autism spectrum. But it has a black box warning. And the black box warning for all antidepressants, not just for Prozac, but for all antidepressants, is that it might increase, any of them might increase the risk of suicide in children or adolescents or young adults up to age 24. So these people should be monitored to see if they have any unusual activities that might suggest that they're at higher risk for suicide. So for instance, anxiety or agitation or panic attacks or insomnia or irritability or hostility. They should be signs to be extraordinarily careful, especially in the relatively young people or young adults taking the drug. Now, the drug may elicit some seizures, but the most common side effects present in more than 10% of people who take the drug can be nausea and diarrhea and insomnia and anxiety and nervousness and loss of appetite and sleepiness and tremors. Between 5 and 10% of the people are going to suffer from dizziness and sweating disorders. A significant percentage are going to develop a rash, more so than with any of the other SSRIs. And these drugs, including Prozac, have a tendency to cause sexual dysfunction, loss of libido, or lack of orgasm, or lack of vaginal lubrication, or erectile dysfunction. The company says it only is about 1 or 2% of the people taking the drug, but other studies have shown that there may be some effect on sexual function in as many as 70% of people, so a significant incidence. And bleeding might be increased. Bleeding, especially if you happen to take an aspirin or a non-steroidal anti-inflammatory, or worse yet, if you're taking warfarin or one of the newer drugs like Eliquis or Pradaxa or Xarelto, you could get a nosebleed or some bleeding into the skin, sometimes some gastrointestinal bleeding, and it might actually even be fatal in some people. Well, the drug can affect your appetite, so a significant percentage of people will lose some weight on taking the drug, but some people actually gain weight, and some people can get an allergic reaction. They might get some hives, which is okay, but sometimes the hives presage a more important immunologic reaction that can be associated with fever or joint pain or swelling or even some respiratory distress. The drug can decrease the blood sugar, especially in diabetics, so you have to be careful. When it's discontinued, the sugar might go back up again. And in certain people who have abnormalities on the electrocardiogram, well, it could presage some significant arrhythmias. Now, in people who have the bipolar disorder, that's manic depression, well, in those individuals, taking Prozac might elicit a manic episode. So that obviously isn't good. And some people are going to suffer from some cognitive and some motor impairment. So these individuals are going to have impaired judgment or thinking, or their motor skills are going to be negatively impacted. And if you happen to have narrow angle inside your eye, it might precipitate an attack of narrow angle glaucoma. And some people may develop what's known as the syndrome of inappropriate antidiuretic hormone. So what in those individuals happens is that the kidney can't concentrate correctly, and as a result, it retains water, and then as a result, your sodium goes down. When your sodium goes down, if it goes down too much, especially if you happen to be elderly or you're volume depleted because you're exercising or it's the summertime and you're not drinking enough water or you're taking a diuretic, then the symptoms might include headache or difficulty concentrating or memory impairment or confusion or weakness or unsteadiness that can progress to hallucinations and seizures and coma if the sodium gets too low. And then there's the serotonin syndrome. And the serotonin syndrome is a condition that one can get by just taking Prozac alone, or if Prozac is combined, fluoxetine is combined, with any of the other drugs that might impact on serotonin metabolism, like the triptans you take for migraine headache, or the tricyclic antidepressants, or fentanyl, or tramadol, or some of the other antidepressant drugs. And the symptoms of the serotonin syndrome are in the gastrointestinal system, nausea, vomiting, diarrhea, the autonomic nervous system, where your heart rate can go up, you can have labile blood pressure where it goes up and down, you get dizzy, flushing, headache, you get sweaty. Neurologic symptoms include tremor and rigidity of the muscles and incoordination. Person can have some mental status changes with agitation and hallucination, delirium or coma, and some people develop seizures. Well, if you're taking the drug and you finally decide, you know, I'm really not depressed anymore, I don't think I need to take the drug, I think I'm going to come off the drug, well, you have to be careful coming off of these drugs. You should do it relatively slowly. Fortunately, the half-life of Prozac is pretty long, so there's not too much of a problem, but it does need to be tapered because you could get some side effects, and the side effects of coming off of the drug can mimic the depression that you had that caused you to take the drug in the first place. So some people have some balance problem or insomnia or anxiety or headache or fatigue or irritability. Some people complain of dizziness or feel electric shock sensations. We call them brain zaps, associated with some numbness and tingling and sometimes crying episodes or shaking or night sweats. Well, the one good thing that we can say about the drug is that it's been on the market for a long time, and more than 40 million people have taken the drug since the mid-1990s. There have only been about 1,600 reported overdoses, and most of those are not associated with significant symptoms. Some nausea, vomiting, fast heart rate, maybe some tiredness. Usually people heal without sequelae. However, some people develop permanent symptoms, maybe some confusion or unresponsiveness or vertigo, tremors. There have been about 200 reported deaths. The drug is not appropriate for most pregnant women. Taking it during the first trimester might actually result in some cardiovascular abnormalities, and newborns born to women who were taking the drug during the third trimester might have significant issues that require prolonged hospitalization and respiratory support and tube feeding. It's unknown whether it's a withdrawal syndrome from the medicine or a direct toxic effect of the medicine. Can occur immediately at birth, or it can be delayed. Infants who suffer from the withdrawal syndrome may manifest with chronic crying or vomiting, temperature instability or apnea or seizures or low blood sugar or low blood pressure or tremors or irritability. And there's an increased risk for something known as persistent pulmonary hypertension of the newborn. And a recent study from UC Davis suggests that it might increase the incidence of autism. Again, not recommended for nursing women. It may interact with a variety of drugs, so if you're taking the medicine, you should consult with your doctor or your pharmacist if you're going to add some other kind of medicine. The way the drug works, it's supposed to work on the serotonin receptor. Actually, the name of the drug, selective serotonin reuptake inhibitor, that sort of gives it away. However, it also antagonizes the acetylcholine receptor and histamine receptor and the norepinephrine receptor, and it changes the sodium channel. So we're not exactly sure how the drug works. Well, if you start taking the drug, acutely, the half-life is going to be between 1 and 3 days. But after you've been taking it for a while, your body sort of adjusts, and the drug actually stays in the system for 4 to 6 days. And if you have any liver disease, it's even longer than that. And one of the major metabolites of the drug, called norfluoxetine, that stays around for anywhere between 5 and 15 days. So that means that if you stop taking the drug, you're still going to have some of it in your system for at least about a month. And if you're taking fluoxetine or Prozac and you stop, a week later, you still have about 50% of the concentration in your brain. Well, the history of the drug is kind of interesting. Eli Lilly, the drug company responsible for the drug, started looking for an antidepressant. They started looking at histamine, antihistamines. And they looked at Benadryl. And they wanted a drug similar to Benadryl, but that really worked on the serotonin action, or serotonin receptor. They thought that serotonin was very important as far as the concept of depression was concerned. That whole idea came, interestingly, from the Seaview Hospital in Staten Island in 1951. It was a TB sanitarium. And what happened is that they had a new drug, a drug called iproniazid. And iproniazid, when it was given to people who sort of were in the doldrums, they had tuberculosis, they were in the sanatoria, they were just really had no future. And all of a sudden, when they took this drug, they seemed to be happy. They seemed to start to show some life. Well, it was found out later that that was perhaps because of increased serotonin in the brain. Then a couple years later at Duke Hospital, a 28-year-old woman was given rhodopsin. And this drug was used for high blood pressure, seemed to elicit in the otherwise normal individual crying spells, feelings of guilt, hopelessness, and lethargy. And it was found later that that was due perhaps to a decrease in the serotonin. Now, if we look at the brains of people who pass away who have depression, we find that some of them have normal levels, some of them have increased levels, and some of them have decreased levels of serotonin. So that doesn't really give us a clue. Well, some studies at Yale in the 1990s showed that if they looked at people who were depressed, who were taking these drugs, taking drugs like Prozac, and got better, if they were given another drug to make the serotonin level go down, then they became profoundly depressed. So that would sort of seem to suggest that the serotonin story might be correct. And in 1994, at McGill University, they took some students and they gave them medicine to decrease the serotonin, and the mood didn't really change all that much in most of the students, unless they had a family history of depression. If they had a family history of depression, then their mood significantly worsened. Well, Prozac was discovered in 1972. It was used for the first time as an antidepressant in 1974. Submitted an application to the government in 1977 to use it, and it didn't get approved for about 10 years. So in December of 1987 came to market. Well, the first year sales, because it was a novel class, first year sales were through the roof, $350 million. Became the third most commonly prescribed drug in the United States in 2008, and at its peak it brought in about $2.5 billion a year. The name Prozac actually was a made-up name by a company called Interbrand. What they did is they looked around to see what would make a drug have a good name, and they took Pro. It's sort of for professional, positive. And X and C are letters that stand out, so they put one of those in there. And then the AC, the AC, that stands for action. So Prozac, that's how it got its name. In the 1990s, there was a lot of positive press. There was amazing response. We had Prozac Nation, and we had listening to Prozac. But then in the 2000s, we had a doctor at Cardiff University, a professor of psychiatry. And he wrote a book, actually, called Let Them Eat Prozac. And that showed the sort of unhealthy relationship between the pharmaceutical industry and depression. And then Dr. Irwin Kirsch, he was a psychologist from Harvard, he wrote The Emperor's New Drugs. And what he did was he evaluated 38 published studies. And he combined all of these studies on Prozac. And he found that the antidepressant effect in about 75% of the studies could have been just merely the same as placebo. And when he looked at the published and unpublished studies, the likelihood of the drug working the same as a placebo increased to about 82%. Well, they reevaluated his studies subsequently in 2010, and what they decided was that for people who had mild to moderate depression, the effect of the drug was probably null or negligible. It's only in those people who have significant depression, severe depression, well, those people seem to get better. Now, the positive effect of Prozac or fluoxetine seems to have something to do with regrowth of cells in the brain, and specifically in the area of the hippocampus. And it seems if we block this, then the Prozac doesn't have any significant effect. The only areas of the brain where we know that we can develop new tissue, new neurons, is the hippocampus and the olfactory bulb. Well, another doctor at Emory University, Helen Mayberg, what she did is she mapped areas of the brain, and she found there was an area near the hippocampus called the subcallosal cingulate. And what happened is that in this area, that's a conduit for the control of conscious thinking and emotions, she stimulated that area with a probe, an electric probe. And she found that there was a 75% improvement in the mood within seconds. So then the probes were put in and kept in. And it was found that areas rich in the nerves that were sensitive to serotonin were essential. And if the serotonin was blocked in that area of the brain, then the electrical stimulation didn't seem to work. Well, it seems that there's a lot more to whether the drugs work on just serotonin or not. What about the choice of an antidepressant? Well, is there any relative difference between the antidepressants on the market? And the answer is pretty much no, not really. You should choose on the basis of the side effects or the safety or the tolerability or the cost or the patient preference or the doctor preference. But the drug companies are pushing a lot of these drugs, and a lot of people are taking the drugs. A lot of people who might not be benefited any more than a placebo and as a side effect or a side comment. It seems that Big Pharma right now is on a roll to push the antipsychotics, the atypical antipsychotics, drugs like Abilify or Risperdal or Zyprexa or Vraylar for the treatment of depression. But those drugs can significantly harm people. So we have to be a little bit careful on which drug we choose. Well, there's less of a stigma to talking about depression than there once was, because there's all this direct-to-consumer advertising constantly talking about drugs and saying, well, it's not really an emotional problem, it's actually just a chemical brain problem, to a point where Dr. Peter Kramer says that we're talking about cosmetic psychopharmacology. Well, the worrying situation is that beginning in about 2000, we have a lot more doctors prescribing these drugs for children. And you have to think of it, that most of the people who are taking the antidepressants are being seen by either family doctors or internists. They're seen within a few minutes. And these drugs that were originally meant for relatively short-term use have been taken for long-term duration. So about 34 million people in the United States right now taking the drugs. 25 million have been taken for more than 2 years, and about 15 million have been taking the drugs for more than 15 years. But remember, the original studies were for maybe 2 months. If you have a crisis, maybe up to 6 to 9 months. But we don't really know what happens with long-term use. The only thing that we can say is now that they've become generic, now that Prozac is available as fluoxetine. The price has fallen. If you want Prozac itself, the price is still going to be somewhere between $450 and $500 a month. But if you have a coupon, you can get the generic for less than $10 a month. Well, so now you know about Prozac. The important thing to know is, if you're receiving the drug, is it really appropriate for you? Or is it acting as a placebo? Do you really suffer from significant depression? Do you suffer from mild depression? There is a major difference. And how long should you continue taking the drug? If you're given the drug, do you really need to take it for long periods of time? Did you have a situational problem? Was it because of some stress that your depression seemed to begin? Well, all of those issues need to be considered. And remember, for some people, the drugs are very important. For a lot of people, they're not really all that much different from placebo. And yet, for other people, taking Prozac or fluoxetine might be associated with actual harm. Anyway, thanks for watching. I'm Dr. Ken Landau.